this year's upcoming governmental election, there are many issues to be addressed. Some are Michigan-based, while others start here at home and spread nationwide. Every day we're hearing commercials about politics. Mainly, it's one politician bashing the other politician. I personally, as a voter, don't want to hear what your opinion is about your competition. I want to hear what you can and will do for me. So that's how I'm going to base this speech. I'm going to address a few issues that are in the headlines today and give you my opinion on how they could or can be fixed. I don't align myself with any political party. I want the best person for that job in office to do the job that we pay them to do. I don't know if that makes me independent or not. I just vote for whoever I think is best. So, on to my speech. The number one thing you're going to hear Michigan residents complain about are our roads. They're horrible. Potholes are forcing drivers to drive like they're drunk, veering in and out of lanes to avoid vehicle damage. This could also cause car accidents in itself. Some counties can't afford to fix the roads. They need more government support from the statewide government. So the counties are just doing quick fixes, those patches, just filling the holes. We need a more permanent fix to our roads, something that can withstand a Michigan winter. We all remember last year's winter, right? And I've heard that it's supposed to be like that again this year. We need to stop wasting money on building things like roundabouts and put the money towards fixing our roads. In his 2012 State of the State address, Governor Rick Schneider stated that the Michigan roads are underfunded by $1.4 billion. Now, this is 2012, but I'm sure you all can agree this is still an issue. We're seeing it every day, anytime we drive. So, my next issue that I would like to bring up is minimum wage. This past Labor Day, Michigan's legislature raised the minimum wage from $7.40 an hour to $8.15 an hour. This is a 75-cent increase. Sounds good, right? On the surface, yes, but if you dig deeper, not so much. Let's crunch the numbers. Have you been to the grocery store lately? You'll notice that the prices have raised. Last year, a gallon of milk at Meijer cost $2.69. Yes, some stores are on sale for that price right now, but we're working on an average, non-sale price. Now, this year, the average price for a gallon of milk at Meijer is $3.17. This is in part due to the minimum wage increase. When the minimum wage is increased, employers are forced to pay their workers more, thus cutting into their profit margin. So they raise the prices on their goods and services to increase their profit, to make up for their loss. So while minimum wage increase is a good thing on paper, face it, minimum wage isn't enough to support one person, let alone a family. Think of a single mother with kids. She can't support them without working multiple jobs. But if we look and crunch the numbers, we're spending more this year than we were last year, even though some of us have seen a few cents increase on our paychecks. Some of us may have not because we were already making that over minimum wage amount. We need the government to step in and put laws in place to stop businesses from raising their prices in a dramatic fashion so that we can actually see the difference in minimum wage. The cost of living rises, so does our pay. It doesn't balance out very easily. This has to be done on a federal level, but our local politicians can start getting the ball rolling in that direction. The last issue I'm going to address is the biggest headline you've been hearing in the news, Ebola. I'm a healthcare worker, so of course I've been paying attention to this very closely. It's not as easily spread as some of the newscasts will make you think, but that's a different issue. What we do need is the government to step in and make sure there are standard precautions put in place so that more healthcare workers or even simple civilians don't get this virus. Beaumont Hospital in Royal Oak has already held a Ebola drill to make sure that their staff is ready and prepared for an Ebola emergency. I personally work for St. Joseph Mercy Hospital. I haven't heard anything. There was a small little article on our hot sheet, but I didn't see anything about us actually preparing. I'm not in the main hospital, but I'm on one of the sidelines on the main campus. We should know what to do. I think the local government needs to step in and make sure the hospitals are doing the same thing Beaumont Hospital is doing, if not the same exact thing, something similar. We need to be prepared so we can wipe this out. Also, Michigan Congresswoman Candace Miller thinks we should suspend visas to people coming into the United States from those countries most affected by the virus. I don't think this is the right thing to do. It's been proven in the past that isolation through immigration just does not work for the United States. People who want to get into the United States enough will find a way. What we need to do is have the government step in, possibly through Homeland Security, and have people monitor these immigrants coming into the United States for at least 21 days, the isolation period or incubation period of the virus. This could be done through a simple phone call a couple times a week to that person, asking them a series of questions to see how their health is doing. This could be on a nurse's hotline. But we also need to make sure that the immigrants coming in are well educated about the virus and its symptoms. But not only the immigrant themselves, the people that they're going to be around the most, their neighbors, family they may be staying with, the employers they may be working with, and even the schools that the children may be going to. Education is key. Isolation, not so much. These are just a few of the issues that I've personally seen in the headlines and think need to be really paid attention to by our politicians. If I was a politician, this is what I would focus on in my campaign. I know as any political campaign or anything to do with politics, I'm sure many of your opinions differ greatly from mine. But I hope you've enjoyed this speech. I hope I made sense. And I look forward to hearing from you. Have a nice night.